My name's Dr. Joseph Ekong. I work with the Uganda Catholic Medical Bureau, which is the health department of Uganda Episcopal Conference, based here at Zambia, just near UCTV. And I'm also happy that you invited me to talk about cervical cancer, as this is cervical cancer month. Number one cancer in women is cancer of the breast. It affects many women and men alike. Though men are few, about 4% of men get cancer of the breast. But however, the second most common cancer in women is the cancer of the cervix. Now, why it is a concern is that it is one of those cancers you can prevent. You might not be able to prevent so much the cancer of the breast, but the cancer of the cervix, for it, is preventable. And if you screen early, you are able to get this cancer. So what is cancer? Cancer basically, our cells of our body, they grow. That's why we increase in size. That's why sometimes you get a wound and the body is able to close that wound by itself. But however, it comes a time when these cells, the body cells, will start growing abnormally without being controlled. The body, your body controls. It knows that this is the size of the head, this is the size of your foot, your eye, so it's able to keep it that size. But however, when the cancer becomes, it's just an abnormal growth of cells. So when these cells grow, they become bigger. And if it is the eye, for instance, it will become bigger and affect other places there. So cancer of the cervix mostly affects the neck of the womb, or the mouth of the womb. It affects that part that enters into the womb. So when you are delivering a baby, it comes from the womb and enters that mouth of it before it comes out. So that mouth part there is where the cancer of the cervix affects. Now, this cancer of the womb, there is a virus that has been associated. Over about 90% of the cancers of the cervix is associated with a virus. It's called human papillomavirus. This human papillomavirus is a common virus. It lives in the skin. So it is common in our midst. It has that virus. So it is the one which has been associated with most of the cancers of the cervix. It also affects men. Normally it goes, the strategic point where it affects is that the mouth of the uterus of the womb. But also in men, it causes also other cancer of the penis. It causes cancer of the throat, cancer of the mouth. So it has been associated with some of those, even the cancer of the rectum. It also affects in those places this virus. Many women may not be able to know that they have cancer of the cervix. Most of the women, they present when they already have complications. Complications mean that the cancer has eaten most of the cervix. So it is now in a late stage. So when somebody comes late, that's when you will start feeling some symptoms. But in most times, you may not feel that actually you have a cancer of the cervix. But when it is late, that's when somebody, probably when they are having sexual intercourse, you may feel a bit of pain or bleeding. After coitus, then you feel some bit of bleeding coming out. So probably you have this. Or you have pain in the lower abdomen. There's a pain there, which is burning pain. You are not understanding why this pain is there, constant. But sometimes some of them actually come, when it is already coming out. You see something already is coming out there, then they come. But most of it is the bleeding, because bleeding is the one which will make the woman to come back, because it's bleeding. But also it can come because these are abnormal cells that are growing. And because they are abnormal, they also lead to excretions. So they may have a discharge which is foul smelling. If somebody sits and you're able to smell, they say, hey, what is happening? So those are the things which will bring a woman mostly. Bleeding will bring her, or that pain, or pain after coitus will bring her, or bleeding. But most people come because of they are bleeding. They tend to tolerate the other one, take some Panadol and so forth. So that's the common way this cancer presents. But also this cancer can spread to other parts of the body. It may spread to the lungs. When it spreads to the lungs, somebody will have a cough, you cough blood. It may spread to the bones that are surrounding the pelvis. And when it spreads in those bones, somebody may get fractures or may have constant pain in those bones. It can also go to the brain. And when it goes to the brain, somebody will lose unconsciousness or have bleeding in the brain. So this is how terrible. Cervical cancer is one of those which can be prevented. And there are two ways that we can prevent this cervical cancer. Every woman of a childbearing age, that's about 25 to 49, and in some countries up to 65 years, you must have a regular checkup. You go and they check on you. There are two methods or three that they can use. They can use visual inspection with acetic acid. So the doctor or a nurse will apply acetic acid on your cervix and we're able to see color change. Is there something that has happened? Or they can do what they call they can take what they call a pap smear. They scrap a few of cells there and they go and test. But that virus also, it can be tested and you're able to find out that this virus is there. And now the women should be screening every 3 years. Every 3 years you should be able to go and have yourself screened to know whether you have cervical cancer or not. Even if you have been negative, you screened you last time and they find that you are now okay, please keep up your appointment and be able to screen. The good thing is that most of our facilities can screen you. You can go to Zambia here, they will screen you. Rubaga, all the facilities, for instance, all around Kampala, I can say most of the facilities in Central Region here, and even in other parts of this country. If you went to any of the Catholic founded facilities, they will be able to screen for you and know, do you have this disease or not. Cervical cancer affects all women alike. Either you are HIV negative or HIV positive. Because I told you earlier on, it is this human papillomavirus that is known to predispose you to do that. However, there are other risk factors that all women share. For instance, women who have early sexual intercourse. So if you start having sex early, it's most likely that you are likely to pick this virus, human papillomavirus, which can cause you problems. The other one is people who live in abject poverty. It's common among them because, you know, some of these diseases like living there. But possibly, if you are poor, you are really in abject poverty, it's possible that you are also not feeding well, so your immunity is also not okay. So you are most likely to get disease. And the other one is people who have lowered immunity. And this includes people who have HIV. People who have HIV have a very high chance, about 36 to about 100% chance to get this disease. So you can easily get this disease and it can affect you as such. So it is important that not really saying that because A, B, C, D, the other person is HIV positive. Yes, the chances are higher, but even alike, all the other women who have that. Women who have produced more children, the so-called multigravidas, they also had a higher chance of getting this disease. And then, of course, people who have many sexual partners, or you are married to somebody who has also multiple sexual partners. So you are this person is likely mostly to pick this virus from wherever sexual partner he or she has and be able to transmit to the other one. So the problem is that the reproductive system of a woman is not born when it is already mature. But this reproductive system keeps maturing, the cells are growing until it reaches a certain age. So when this woman happens to have sex early, this girl, she's likely to have a traumatic sex, and these tears which she gets in her reproductive system also will aid the entry of this human papillomavirus into her. So because of that, that's why it is likely that. But also this woman is likely to get pregnant early, and when she gets pregnant early, most likely is going to get so many children. Women who get married at 12 years, most likely if they are active, they may end up with 12 children, 13 children. And as I said earlier, these multiple pregnancies also predispose one to get cancer of the cervix. But there are other factors, of course. But the issue here is a human papillomavirus, because when you have multiple sexual partners, then you are likely to pick this virus from the other partner. You may be in a polygamous marriage, but you are strictly on whatever number you have, and none of you is going out. But in case somebody is going out, you can actually pick the virus. But one of the things we really need to know, what is behind this screening? Because it's for your health. I have seen a number of women who don't want to be screened, and you just plead, and he said, let's just check on you. And most of them have actually turned out to be having cervical cancer, the precancerous lesions. And some of them they just don't want. So what I can only encourage is that, once in 3 years, you can forget the pain or the embarrassment you have felt, but at least you are sure that I know that I don't have this disease, because otherwise it's not easy to treat cervical cancer once you have it. The treatment is quite laborious. It has a lot of side effects. You may end up losing part of your body because they have to cut it off, or you may actually die. Cervical cancer in Uganda is actually a big burden. Among the HIV negative women, if you have 100 women, about 10 of them are likely to have something which is developing to become a cancer of the cervix. About 10 to about 40% of these women, yes, those are the HIV negative women. So meaning that if you have 10 women who are walking, maybe 3 of them may be having a lesion or are likely to get a cancer of the cervix. It's a different story with the HIV positive. About 36 per 100. If you have 100 women, about 36 of them are likely to have this disease, or sometimes all of them may actually be having. So that's why it is very, very, very important that we screen, even if you look normal, because as I told you that most of this cervical cancer, actually, by the time you realize a problem, you are actually in an advanced stage of this disease. We vaccinate girls 9 years to 14 years. We vaccinate them against HPV or human papillomavirus. They get 2 doses. They get the repeat dose is after 6 months. So it is the only cancer that is preventable by immunization. So we have this program going on, and all our facilities actually have this vaccine. You can go and the child is immunized 9 years to 14 years, and he receives that. Other countries even go beyond. They also vaccinate the male boys and other older women. But for us here, we do it for that age, and mostly only for girls, because as I told you, the cervical cancer is the second most common cancer here in Uganda. So if you have a daughter of that age or you are of that age, please go to any nearest health facility, government, Catholic, or whatever facilities near you, and you'll be able to receive, that girl will be vaccinated, and it will protect her against that virus, which is associated with cancer of the cervix.